This is Selma Schimmel at ASCO 2011, where our conversation continues with physicians about a variety of topics. But this one's very, very special because it's an area of medicine that we need to talk more about. And it has to do with how we confront later stage of disease, end-of-life issues, palliative care, hospice care. It's all a part of life. We're going to spend time with one of the leaders in the United States in this area of medicine, Dr. Jamie von Roenn. And Dr. Roenn is a medical oncologist, treats breast cancer, but is also the medical director of Northwestern's Memorial Hospital's home hospice programs, professor of medicine at Northwestern University, Feinberg School of Medicine, Robert H. Lurie Cancer Center right here in Chicago. First, congratulations, because you are the recipient of the 2011 ASCO American Cancer Society Award and lecture for your really pioneering work in palliative medicine and cancer pain management. And that's just thank you on behalf of survivors like myself.
Well, thank you. For me, just the fact that I got it says that palliative care is coming forward, because that lectureship was recognizing my palliative care voice in oncology, and that means ASCO is willing to embrace this in the care of oncology patients.
If you would like to elaborate a little bit from your own perspective and in your own words, what palliative care means to you as a clinician.
Well, to me, it's interdisciplinary whole-person care. All of this discussion about personalized medicine is mostly talking about molecular targets, and there's that word person in there. And so it should be treating unique features of the cancer, but also individualizing therapy for the person, so that you take into consideration who they are, what's important to them, who they live with, because cancer affects the person, but it affects everybody who loves them. And so palliative care addresses the physical, the psychosocial, emotional, spiritual, practical. It's really exactly what care is about, in my view.
I never have quite understood why the discussion of the whole continuum of care, the circle of care, which could include end-of-life issues, why it's not a natural part of the dialogue between patients and their doctors, and then it seems that it comes up at the worst possible time, sort of like when crisis hits or bad news comes, and it's towards the end, and so you're not prepared at all, and then it's like this crammed-in discussion, and instead of easing into it, and then instead of it being natural, it feels overwhelming.
Yes, so I think there's a lot of reasons for it. One is oncologists aren't trained adequately in communication skills and in prognostication, honestly. I think another reason is there's this cure-care dichotomy, where for a long time the issue was you treat the cancer, and then when there's nothing else to do, you move to palliative care, when in fact, this idea of palliative care should be across the spectrum. That's what this continuum issue is about. So that, for example, if I give you chemotherapy that I know is going to cause nausea and vomiting, I sure better prevent that nausea as best I can. That's palliative care, early. For advanced disease, though, what we don't do, you're right, is prepare people adequately. In my practice, my approach has been that as soon as someone has metastatic disease, it's time to say, well, we can do this, we can do this, we can do this, but at some time, the proper approach will be to focus on the comfort. And then I drop it. It's just the seed planted. And the next time, since what the natural history is right now of advanced solid tumors is you get a response for some period of time, and then you need to change therapy. And the next time, I say the same thing. And so then when I get to the point where really we should focus on comfort and treating the cancer is more harm than good, I can say, remember when? It's not quite so scary, because in fact, after you drop those seeds, people do think about it some, and it prepares them a little bit better.
What about the issue of family members who will say to the doctor, please don't say anything like that. I don't want to diminish hope, and it's going to ruin the, his or her attitude or spirit? How do you handle that delicate issue and that slippery slope kind of with family members?
I start out by asking what they're afraid of. And then, depending what they say, I talk to them about the fact that people know when their body is failing them, that patients know before we know that they're in trouble, and that think of what it would be like if you were isolated and couldn't talk to anybody and you knew you were dying, because you're protecting everyone who loves you when they think they're protecting you, in fact. And so what I usually do is say, let's go in, and I'll just ask them what they think is going on and what they understand, and I won't tell them anything they don't ask about. And patients always ask once you open the door.
And you know, Dr. von Roenn, the truth is that even the person who's diagnosed with an early stage cancer or the most treatable cancer, the moment you're diagnosed, you ask yourself, what's going to happen? Could I die? Might I die? The mortality component, I'm a 5-time survivor. It is not, you cannot make this journey, even if you tell no one, because sometimes the patient doesn't say anything to family and friends because they don't want to frighten them. But you can't walk this walk without thinking about your mortality. I don't care how early your diagnosis is, it's a part of the natural response to the diagnosis.
So I think that's true. And I've unfortunately had personal experience in my family. And I remember taking this family member for her first scan with metastatic disease. And she turned to me and she said, if my scan is bad, where are you going to bury me? And it was like a light bulb. That's what every patient thinks every time you go to get a scan. And we have to be responsive to that and not pretend like we don't know that.
Typical reaction, response, don't worry about it, it'll be fine. Don't think about it, it's probably nothing. Stay positive, stay focused, and what that does, it completely negates the natural experience.
Yes, and instead we need to validate, yes, this is scary, how can I help you?
The family member, they're scared too.
Of course, of course.
So ASCO has a great commitment now to this whole area of palliative care, education for physicians, demystifying this, creating a language. It's never going to be totally comfortable, but a language where patients can more readily engage with their doctors, with their loved ones. Talk to us about your role in all of this.
I'm not one to take credit, so I think it's many people who have worked together, both from the palliative care end and the oncology end, who went into oncology because they cared in part about their relationships with patients. That to do oncology, you have to care about people, I think. And I think even the people who aren't comfortable with death or comfortable with their communication skills, it isn't because they don't care about the people, it's because they haven't been taught what to do and how to do it well.
And I also think that physicians have to know that it's not a failure on their part.
I think that's right. I also think we need to role model how important this is, so that when an attending goes on rounds with a whole host of trainees, you don't just ask about the white blood cell count, you ask about the patient's goals, you ask about how the family's doing, you ask about what they're afraid of, that you recognize that who the person is experiencing cancer is the most important piece.
Thank you, Dr. Jamie von Roenn. Such a privilege to have had this time with you. Congratulations again, recipient of the 2011 ASCO ACS Award and Lecture for really pioneering work in palliative medicine and cancer pain management. You're a medical oncologist, you treat breast cancer, but you're the medical director of Northwestern's Memorial Hospital's home hospice programs and professor of medicine at Northwestern University's Feinberg School of Medicine, Robert H. Lurie Cancer Center, right here in Chicago.
Thank you for inviting me. It's been a pleasure.